The WHO aims to achieve the global elimination of hepatitis by 2030. Based on this motive, scientists and policymakers are putting efforts to prioritize this objective. The Global Hepatitis Program targets the elimination of hepatitis along with HIV and sexually transmitted infections to reach what is called the triple elimination. For this, the WHO develops strategies by providing evidence-based guidelines and guidance, and also the required technical support in collaboration with many stakeholders, affected communities, civil society groups, academic institutions, and partner organizations within the United Nations system. With this small note on hepatitis, I would like to welcome the speaker of the day, Dr. Sasikala Madam, and all the delegates for this webinar. May I now request Dr. Kadiresan, Director, School of Life Sciences, VISTAS, to deliver the welcome address. Thank you.
Thank you. Good morning to one and all. I take immense pleasure in welcoming you all for the webinar on bringing hepatitis care closer. This webinar is being conducted on account of World Hepatitis Day, which is celebrated on 28th of July every year. The day of July 28 was selected because it is the birthday of Dr. Baruch Blumberg, a Nobel Prize winning scientist who discovered the hepatitis B virus and developed a diagnostic test and vaccination to prevent the infection. And this year's theme is I Can't Wait. That is for this World Hepatitis Day. The World Hepatitis Day organization has given this theme. And this hepatitis, it's a deadliest disease and caused by the 5 different groups of infectious agents that are, you know that, hepatitis A, B, C, D, and E. And worldwide, it is affecting more than 325 million people around the world. And this is the estimation given by the World Health Organization. So roughly the population of United States, that means the 325 million people around the world have been affected by this virus. And this is roughly equal to the population of the United States. And the awareness and understanding of this deadly infectious disease is a crucial one. On this perspective, the Department of Microbiology is conducting this webinar. I'm sure that the participants will get benefited from this webinar. With this note, I am very honored and pleased to welcome our speaker, Dr. Sasikala, Associate Professor and Head, PG and Research Department of Microbiology, Presidency College Autonomous from Chennai. And Madam, this is I'm very pleasure and it's honor to welcome you on behalf of VISTAS management and Vice Chancellor, Registrar, and other high officials. On behalf of them, I'm welcoming you to this webinar. And it's my pleasure to welcome the head of the departments from other departments and my colleagues from the microbiology department and faculties from other.
Sir, I could not hear you, sir. Sir, I could not hear you. Audio, it's not audible. The chat or okay.
There was
it's audible now. It's audible now.
Ma'am, I think I can continue, ma'am.
Yeah, definitely, ma'am.
Thank
you.
I
can continue. Okay. The
moment. I would like to introduce you, ma'am.
It's all right. Shall I continue now?
Ma'am, I will introduce, ma'am, you to the audience and then we can.
Okay, fine.
Thank you very much, sir, for the welcome address. I take immense pleasure and honor in introducing our speaker of the day, Dr.S.Sasikala, Associate Professor and Head, PG and Research Department of Microbiology, Presidency College. Dr. Sasikala obtained her doctoral degree in medical microbiology from Dr. A.L.M. PGIBMS, University of Madras, under the guidance of eminent Professor Dr. T. Sundararajan. She has specialized on molecular basis of drug resistance in microbes associated with sinusitis. She has a rich teaching experience of about 27 years, teaching UG students. I request all to mute your audio and video, please. Thank you. She has a rich teaching experience of about 27 years, teaching both UG and PG students. I'm very glad to inform that she's the first person to be selected as assistant professor in microbiology in the collegiate education of Tamil Nadu government in the year 2000. At present, her research is on the drug resistance of microbes, including Pseudomonas, Staphylococcus species, Klebsiella species, and E. coli. And she is also pursuing research on screening of antiviral compounds from seaweeds and medicinal herbs, screening and molecular basis of drug resistance in pathogens obtained from clinical sources. To her credit, she is the member of the Board of Studies in Madras University and also in its affiliated and autonomous colleges. She is also the member of Board of Examinations in Madras University, Pondicherry University, and other autonomous colleges affiliated to different universities in Tamil Nadu. She is a life member in various associations like IAAM, IABMS, IAMPV, and ISCA. She is editor in various reputed international journals, and she has presented around 80 papers in national and international conferences, and she has published over many papers in many reputed international journals with good impact factors and citations. Above all, I'm happy and honored to say that she is my teacher in my PG program. She's a kind person and she has guided me in the right direction in tough situations. Welcome, ma'am. May I now request you to address the audience of this webinar, ma'am?
Yeah, thank you.
Thank you, ma'am.
Right. Okay. Good morning. Good morning, everyone.
Good morning, ma'am.
Okay, fine. I just need one good morning, that's all. Okay, so at the outset, I like to thank Dr. Kadirasan sir, Director, School of Life Sciences, VISTAS, for giving me an opportunity to meet the young minds and also my student, Gayatri. And I also thank the Vice Chancellor VISTAS, Registrar of VISTAS, Ms. Preeta Ganesh, Vice President of VISTAS, and I congratulate the organizing secretary, Dr. G. Gayatri, and I also thank all the organizing members for making me a resource person for the day. Thank you. Shall we move on to the topic? Yes, I think. So, the topic given to me by Dr. Kadirasan is just bringing hepatitis closer. Okay, actually, I had a class on hepatitis. What is it? What could be the? It said, madam, before the year, I may notice it. Yeah, I said yes. So, bringing hepatitis care closer. All of you are aware of hepatitis. What is hepatitis and what causes hepatitis, everything. Anyway, so to add to your knowledge, I think this PPT or my presentation will help you. Okay. So I think I heard that the audience will be a mixture of UG, PG, PhD, and all the faculty also. Okay, so I start with the basic hepatitis. Yeah, you all know that hepa means liver. Itis means inflammation. So wherever you get the word suffix, that is itis, that means inflammation. Pancreatitis, okay, mastitis, okay, like that. So hepatitis, inflammation of the liver. That's all. So normally, it is hepatitis is referred by a layman as jaundice. Okay, so jaundice, it is not a disease, but is actually a symptom of any disease or any syndrome, I can say. Okay, so hepatitis is inflammation of the liver. Now, what could cause the inflammation of the liver? What are the reasons? It can be divided into infectious and non-infectious. Infectious, of course, we are microbiologists and we put the blame on the microorganisms. Okay, that is like bacteria, parasite, virus, etc. Other causes, non-infectious causes, can include drugs, chemicals, toxins, autoimmune diseases, and some metabolic disturbances also. They can also cause hepatitis. Okay, what's the importance of viral hepatitis? Why a day has been allotted to hepatitis? Okay, Kathirsan sir said it is named after Bloomberg. Yes, right. He only discovered the hepatitis B virus, and he called the antigen as HBs AG, etc., etc. So we should give that credit to him. And so on his birthday, we celebrate the day of hepatitis. Yeah, it's a disease which is of a major concern because it affects people nearly, there is 10 millions. 10 million people are affected worldwide. And jaundice, yes, it's a very common disease affecting the children, mainly in the developing countries. That is why it is instructed, that is when a person move from non-developed country to a developing country, he is advised to take a hepatitis vaccine. Okay, hepatitis A vaccine, hepatitis B vaccine, like that. So without that, he will not be extended a visa. So that is the concern, okay, for a human being when he goes to a developing country or underdeveloped country, something like that. And then India, okay, it is hyper endemic for hepatitis A virus infection. Okay, so knows the term only as jaundice. We microbiologists, okay, grade them into or differentiate them into, I mean, like viral, bacteria, like that, and also into hepatitis A, B, C, D, E, like that. Okay, but for a layman, it is simply jaundice. And not only that, it's not only hyperendemic in India, nearly 1 to 2 lakh people die due to illness. That is why it's a global concern, especially due to HBV infection. HBV. We'll see what causes hepatitis A and how it is. And worldwide, again, 170 million people are affected with hepatitis C virus. Okay, so I can say India, it is 1 to 2 lakh, but HCV, again, 170 people, 170 million people are affected with. So you will know now what is the threat to the human. Fine. How do you classify hepatitis? That is viral, alcoholic, autoimmune, non-alcoholic steatohepatitis. That is, it's called as NASH, or non-alcoholic fatty liver. It means the same. Hepatitis classification. Infectious hepatitis. I already told you it is caused by a virus, bacteria, parasite. Virus, of course, the 5 important hepatitis viruses: A, B, C, D, E. Bacterial hepatitis caused by leptospira. It is also called as Weil's disease or bacterial jaundice. And syphilis, the secondary syphilis, okay, it affects the liver. So caused by treponema. Not only that, hepatitis is also caused by amoeba, entamoeba, histolytica, toxoplasma, fasciola hepatica. Okay, fasciola intestinalis doesn't cause much disturbance to the liver, opisthorchis, and cystosoma, especially hematobium. Okay, the three species are that hematobium, mansoni, and japanicum. Okay, so it is also called as liver bilharziosis when it is caused by a cystosoma. Alcoholic, yes, steatosis results in, and then it causes liver cancer. Not only that, cirrhosis of the liver. That is, the liver loses its function. Okay, we all know what's the importance of liver. Okay, liver aids in the digestion. It makes cholesterol. It produces prothrombin protein. So all the disturbances occur in the liver. And drug hepatitis, yeah, when you take some antiviral drugs, antibiotics, steroids, can lead to drug hepatitis. Hepatitis, exposure to industrial chemicals. Other hepatitis, the reasons could be radiation, it can be autoimmune. Okay, that is, you don't know what is autoimmune. That's the body's immune system attacking the liver cells. Okay, causing inflammation of the liver. And yeah, when you don't find the reason, the blame on the genes. So you know to genes, hepatitis. Right. So when you say viral hepatitis, divide into acute and what acute. Acute liver is not much affected, just like in chronic. Whereas in chronic, it causes liver cells, the liver parenchymal cells, they die and they also get inflamed. Acute, yeah, just the span is only 6 months. Chronic, after 6 months. What are the symptoms with acute? Nausea, vomiting, right upper quadrant pain. So what is this upper quadrant pain? So when you get pain in the quadrant, so normally our, what is it, the abdomen is divided into quadrants. Okay, so when you say that upper quadrant means that's a site where the liver is present. So the doctor, trained doctor, okay, so it can feel or can palpate the inflammation, the inflamed liver otherwise. Okay. Sometimes chronic it's properly, so will you be what is a disturbance in the skin, dark associated with the and chronic, the patient experiences fever, fatigue, and loss of appetite. And become not the patient experiences extra just all over the body in the joints. Okay. Okay, what about A and E? It's caused by hepatitis B, C, and viral hepatitis. Within 8 weeks of each, they might develop hepatitis. Against the eye, the skin becomes blue like this. Okay, then see it in the next few slides. Okay. Anorexia, you will not experience happiness. Symptoms are more pronounced. And Okay. Okay. So, sir, shall I start again?
Yes, madam. Yes.
Okay, okay. இந்த கதை வடிக்காதீங்க. Give me, give me. Screen. நம்மள இங்க இருக்க சொல்லுங்க. மீட்டிங் இருக்காங்க. தெரியுதா? ஹலோ.
Yes, ma'am. Yes, ma'am.
Okay, fine, fine. அடிக்காதீங்க. Right, okay. So chronic hepatitis, the symptoms could be malaise, easy fatiguability, and hepatomegaly, myalgia, and elevated liver enzymes. Okay, I told you there are 4 liver enzymes, and all the liver enzymes will be increased. Okay. Next, and there are 7 known viruses, and then 3 are born through fecal-oral, and the rest are born through body and body fluids. Okay, so we'll see something about hepatitis A virus. Hepatitis A virus, it has got a capsid, and then it's got an RNA, and then BPG is the protein associated with the genome. Hepatitis A. Hepatitis A. It is called as infectious or epidemic hepatitis. Okay, so that's the other name. So we call hepatitis A as infectious or epidemic hepatitis. Hepatitis B as serum hepatitis, something like that. So why it is infectious? Yes, it is it is born through fecal-oral route, and it is highly contagious. And I told you already, it is India is hyperendemic for hepatitis A virus infection. So what's the nature of the virus? It's a small virus, unenveloped, that's naked virus, symmetrical RNA virus belonging to the Picornaviridae family. Okay, Picornaviridae family, and they belong to the enterovirus group. Okay, so what it causes? Acute hepatitis, not chronic, but jaundice, and it occasionally it can cause liver failure. Incubation period is about from 3 to 5 weeks. Okay, what is the source of infection? Okay, because tomorrow is hepatitis day, we should know more about the source of infection. So I told you it is a infection born through fecal-oral route. So crowded conditions, okay, food contamination, crowded conditions can lead to the spread of the infection. Poor sanitation, okay, due to mishandling of food, water, etc. It's contaminated food. It can be any food, water, any seafoods. Personal hygiene is very, very important in curbing hepatitis. And person with subclinical infection, okay, they might be a threat to people in the spread of infections, and mainly food handlers. Okay, so food handlers can transfer the infection at a high rate. Okay, and I told you already about the symptoms. Right, now what is the risk of hepatitis infection? Who is at the risk? Okay, not only the food handlers, but also the staff and residents of institutions for mentally handicapped. Yes, you know very well how difficult it is to handle the mentally handicapped children, or old people. Okay, so there and all, it's a big threat. Daycare centers for children, and then sexually active male homosexuals. Okay, they all pose a threat. And intravenous drug abusers. Okay, sewage workers. Sewage workers also pose a threat to the hepatitis A infection. Healthcare workers, military personnel, because they cannot practice cleanliness always at all the time. and not only that, lower socioeconomic groups and defined community settings. They all pose a risk for the hepatitis infection. What about the diagnosis and treatment of HAV? So normally we say when we get an infection, IgM level antibody, MGM will be on the rise. IgM increases first, followed by IgG. Okay, it's a naked virus. So IgM will be formed against the capsid proteins. Fine. So we will detect the HAV antibodies, that is anti viral antibodies for hepatitis A, IgM, the first instance for 1 week. And thereafter, it will be followed by IgG. And not only that, I mean, we can diagnose this by means of RT-PCR. I think you all know what is RT-PCR. Okay, even a layman knows what's an RT-PCR nowadays. Fine. And what can be the treatment? So normally for hepatitis A, there is as such no drug therapy. No drug therapy is not advised. But what is advised is rest. Yeah, complete rest according to the patient level of fatigueness. And then if it is serious, it can be hospitalized and it can be replaced with electrolytes. Why? Because I told you the symptom can be diarrhea. Okay, and not only that, suppose if he experiences vomiting, then he can be given some anti-emetic drugs. Now coming to hepatitis B virus, Baltimore classification. Okay, fine. We are not bothered about that today. So what are the antigens important to hepatitis B? So not only hepatitis B surface antigen, that's called as Birnbach antigen, okay, named after the discoverer, but also hepatitis B core antigen, HBC. It is not hepatitis B C virus. It is hepatitis B core antigen, hepatitis B E antigen. These two antigens are very important because in addition to the increase or the detection of hepatitis B surface antigen, we also have ELISA for hepatitis B core antigen and hepatitis B E antigen. Okay. So hepatitis B surface antigen, yeah, so there is a small surface protein, that is hepatitis B S antigen, surface antigen, and medium surface protein, and then large surface protein. So there are three varieties in this, and there are ELISAs to detect these HBs AGs. And not only that, DNA polymerase, the enzyme, okay, that can also be detected, and it's an envelope virus. Okay, so I told you hepatitis A virus belong to the Picornaviridae. Picorna means it's a small virus. It is the smallest of the viruses. Okay, hepatitis B belongs to the Hepadna virus. Hepa DNA, Hepadna. So it's a DNA containing virus. So I told you already it is it's otherwise called as serum hepatitis, born through blood or blood products. Okay, and then it is a 42 nm particle. It is endemic in the human population, causes acute and chronic. Incubation period is not days, it is months, and it has got a complex structure. I told you about the distinct antigen, that is hepatitis B core antigen, hepatitis B surface antigen. Okay, the particle size is 22 nanometer, and hepatitis E antigen, it's an independent protein circulating in the blood. So all these three antigens are very important and play an important role in the diagnostics. Okay, this slide shows the geographic distribution of chronic HBV infection. So you will know what is the level of spread of HBV. Okay, now what's the mode of transmission? Hepatitis A, it's born through water, food, contamination. But HBV, it's born through sexual contact. It is much more infectious than HIV. Okay, but what's the difference between HIV and hepatitis? Okay, we can prevent hepatitis. We have got an effective vaccine. Okay, that is a question mark in HIV. It is more infectious than HIV. Parenteral, upper mucosal exposure to blood or blood products. Okay, so when you come into contact with the blood or blood products, okay, come into contact with means it can be a needle stick injury, or it can be a, I mean, what to say, shared needles, I mean, what to say, during drug using, okay, something like that. So that leads to the infection spread in the hepatitis B. Not only that, perinatal transmission from mother to child. Okay, that is after delivery. Okay, and source of infection. What is the infection? Yeah, contaminated needles. Nowadays we use, disposable syringes, but earlier, what is it? Unsterilized or not properly sterilized syringes, needles. They play very important. They played a role in the transmission of hepatitis B. Syringes, not in the instruments. Okay, instruments can also pose a threat to the HBV infection. Unscreened blood transfusion. Okay, not only that, blood products, components of the blood when they are transfused. And homosexual men, tattooing, tattooing the body with the same needle, contaminated needle, body piercing with contaminated needle, say like during acupuncture, something like that. Okay, if it is not sterilized needle, then again we might get hepatitis B, and it can be transmitted by close contact. Okay, close contact or by sexual contact. Okay, so these are the methods of transmission of HBV. Okay, occurrence, it affects, I told you, hepatitis A, it will affect most of the children. But hepatitis B, it affects all the ages. It affects mainly the young adults who are sexually active, both homosexuals and heterosexuals. HBV, why it is why we are very much worried about this? Because it causes cirrhosis and hepatocellular carcinoma. Okay, hepatocellular carcinoma, because this virus exhibits latency. This virus exhibits latency. Latency means this virus inserts its genome in the liver hepatocytes. Okay, and then just like HIV, integrating its genome into the cell genome, host cell genome, it integrates its genome into the host cell genome, liver cell genome, and then remains latent for some months. That's why incubation is very high, 2 to 5 months. Okay, then after that, it causes cancer. Okay, hepatocellular carcinoma or cirrhosis. So what could be the symptom? Yeah, again, abdominal pain, dark urine, fever, joint pain and arthralgia, anorexia, loss of appetite, nausea, vomiting, fatigue, and jaundice. Okay. So test, what are the tests? So normally, when the doctor will palpate the liver, when he come across hepatomegaly, he will immediately not, point out to viral hepatitis. He will think of parasitic hepatitis first of all. Then only he'll think in terms of viral hepatitis. Okay. So in that case, he'll be asking you to do a blood test. Okay, liver function profile. So liver function profile, it will tell you about the levels of the enzymes, liver enzymes, like AST. AST is aspartate transaminase, ALT, alanine transaminase, ALP, alkaline phosphatase, GGT, gamma glutamine transferase. So these three are very important liver enzymes. They will all be on the rise when there is viral hepatitis B infection. And serum proteins will get elevated. PT, the prothrombin. Prothrombin is also a protein produced by the liver. Urinary bilirubin, that will be on the rise. Total serum bilirubin, yeah. When there is a bilirubin in the urine, there could also be a rise in the bilirubin in the serum. Okay, urinary urobilinogen and total serum bilirubin, all will be on the rise when there is serum hepatitis. Okay, what are the serological tests? So this is to tell whether the liver is inflamed or what is the level of infection. in what stage he is. Okay, but how to put the blame on hepatitis B? Of course, you have to do a serological test. You have to detect the antigen, that is detecting HBsAg. Okay, so normally any test, serological test, you will detect either the antigen or the antibody. Normally, in hepatitis, we'll be looking out for hepatitis B surface antigen first. Okay, hepatitis B surface antigen is found abundantly in the blood. Okay, and we can use it readily as a marker for the diagnosis of hepatitis B. But we can also do a antibody testing, that is anti-HBs. There's also anti-HBs test and anti-HBe, anti-HBe IgM, anti-HBe IgG, because we have to differentiate the levels of infection, whether it's acute or chronic. And then HBV, you can also do a HBV genotyping, right? So not only this, okay, to assess the level of hepatitis, okay, we can also do a ultrasound. Transient elastography can show you the amount of liver damage. And the patient can also go in for a liver biopsy, and then you can also do a fibro test. Fibro test is to detect the fibromyalgia. Okay, so it is not normally seen through a X-ray, so you have to do a fibro test for that. Management. How can you manage hepatitis B? Okay, so it is indicated only in patients with severe hepatitis and liver failure. So yeah, the patients are advised to go on a rest, vitamin supplements, and you should avoid alcohol. What could be the treatment? Of course, antiviral drugs like tenofovir, adenofovir, lamivudine, interferon treatment. So normally any virus infection, we give a interferon therapy, standard interferon, intron A, and pegylated interferon. So that is pegylated interferon. It is conjugate of alpha interferon and PEG, polyethylene glycol. Okay, it's a anti-neoplastic agent. So normally pegylated interferon, pegintron, it is advised for treatment for hepatitis B. And if the liver is seriously damaged, okay, they can be advised to go on a liver transplant, because we know what is the property of liver. Liver, when you transplant a small portion of the liver, it can grow. Okay, liver has got the power of, not say, regeneration. You all know, I think. Fine. Now coming to hepatitis C virus. Okay, hepatitis C virus, the structure, it has got an envelope, a capsid, and it has only a single stranded RNA. So it's again a RNA virus, just like the hepatitis A. And it has got glycoproteins E1, E2. So it's an envelope virus, not naked like hepatitis A, but it is related to flavivirus. Okay, flavivirus. Flavi means yellow. Okay, it causes yellow fever. Flavivirus, because it causes jaundice. Okay, but normally flavivirus are born through arthropods. But hepatitis C, it is not born through arthropods. There's a differentiation between other flavivirus from hepatitis C virus. Incubation period 14 to 180 days. Okay, again, I know what to say, 6 months. So about, I told you, how many people are affected worldwide, right, so far. And then how it is transmitted? Again through blood product, just like hepatitis B. Just like hepatitis B, it is getting transmitted. And then how it is transmitted? Yeah, through unprotected sex, using contaminated or unsterile needles. Very common in the IV drug users, and not only that, renal dialysis patients. That I told through instruments also that get spread. Yeah, the dialysis instrument also poses a threat to the patients who has not got hepatitis. Fine, and it can also result in both. It can cause both acute as well as chronic illness. And remember, hepatitis C is a very important cause of liver cirrhosis, more than hepatitis B, I could say. Okay, and there is no vaccination for HCV, but we have got effective vaccine for HBV. Okay, so hepatitis C is seriously looked upon than HBV because in HBV we can prevent, but HCV we cannot prevent it. Okay, there's no vaccine. Fine. So prevalence of hepatitis C virus infection, WHO. Okay, where and all, okay, hepatitis C spreads. So worldwide, about 350 million people have chronic hepatitis B and C infection. Put together. Diagnosis, yeah, you looking for the hepatitis C antibody. So normally we look for the antibodies to a viral antigen. Okay, and we can also do a HCV genotyping because normally nowadays ELISA, we do an ELISA, we do a Western blot, we go in for the genotyping, especially in the research institutions. Management. Yeah, again, treatment with regulated interferon pegintron within the first 12 to 24 hours. This can reduce the development of chronic hepatitis C. We can stop with acute, or we will not prolong, or we will not make the patient a liver cirrhosis patient. Okay, when you start the treatment earlier, the patient will not go on to the liver cirrhosis. Okay, that is why we have to, start the treatment immediately with hepatitis C infection. Okay, what could be the treatment? Yes, addition to Pegintron, Ribavirin, Rebitol, protease inhibitors such as Insevic and Bosprovir. All these are antiviral agents, and this could be given to the hepatitis C patients. Okay, so if they respond to the treatment, they will not get liver cancer. Okay, hepatitis D virus. Okay, hepatitis D virus, it's called as a Delta virus. Okay, so here, when you see the structure, hepatitis delta antigen, that is the core antigen that contains a RNA, fine. But it has got an envelope, okay, something with hepatitis B surface antigen. Okay, so what is this? Yes, it is a helper virus. It's a defective virus. Hepatitis D virus is a defective virus. So, defective virus needs the help of a helper virus. Helper virus could be hepatitis B virus. So, the patient should be infected with hepatitis D and hepatitis B together. Okay, together. So, when they are affected with both the infection, it is called a co-infection. Okay, when there is hepatitis D and over that hepatitis B infection, it is called as a super infection. Whether it's a super infection or a co-infection, the patient has to be infected with hepatitis B in addition to hepatitis D. Only then hepatitis D can cause some disturbance in the patient. Otherwise, there is no damage to the patient. Okay, that is virus cannot replicate. So it is called as a defective virus. It contains single-stranded circular RNA virus that cannot survive on its own. It's similar to so it can also be called as a satellite virus. Okay, it is actually a virion. Virion means it is born from a plant. It's a plant virus. Okay, it's originally a plant virus. Later it became a animal and later on a human virus. Okay, it requires hepatitis B to replicate. Incubation period is very, it is 2 to 26 weeks, less than hepatitis B. And chronic carriers, yes. Chronic carriers of HBV, they can easily contact the infection with delta hepatitis. They're always at a risk for transmission. Okay, so I told you, yeah, they should have a co-infection or they should be super infected with hepatitis B or with D, something, whatever it is. Okay, either they can get D or B or B or D, something, whatever it is, right? And mostly pregnant women are affected. So this is the spread of, this shows the spread of, hepatitis delta virus infection. Okay, and then what the diagnosis? Yeah, you can detect the anti-HDV, that is antibodies for HDV or HDV antigen as such, because it carries the hepatitis B surface antigen also. Okay, HEV structure. HEV, yeah, it belongs to Calyxy virus. Okay, it's again a enteric virus. So it's again envelope virus containing, containing an envelope with proteins GB120 and GB41, and core proteins. It can be P17, P24, and then the core, the inner core. Okay, that contains the reverse transcriptase uh, genes and its proteins, and the protease, integrase. All these could be diagnostic markers. And RNA in the P7 nucleocapsid. So all these could be markers, diagnostic markers of the HEV virus. Hepatitis virus, it's a single chain RNA virus. It's a envelope virus. It is transmitted through fecal-oral route. It is always called as non-A, non-B hepatitis. Okay, so hepatitis A is referred to as enteric hepatitis, whereas hepatitis E is called as non-A, non-B. When you say non-A, non-B, that means it is hepatitis E. It is a very rare disease and illness is self-limited. It is found in Asia, Africa, and Mexico. Incubation period, yeah, it is very, very less. Yeah, 15 to 64 days. I told you already it is a fecal-oral transmitted disease, yeah, resulting due to poor sanitation. Okay, mainly due to floods. Okay, when there is a acute shortage of food, something like that, contaminated food, shortage of food, water, that can be the source of infection. Hepatitis E, there is no need of a treatment and it can resolve on its own. Okay, so when you get any viral infection, we normally say that can resolve on its own, something like that. Okay, that is within 6 weeks. Okay, genotype 1, that can cause human disease. Diagnosis, you're looking for the anti-hepatitis E virus antibody, both. That is, you can look for both the IgM type or the IgG type. Sometimes you can also quantify the RNA. Okay, quantify the RNA from the sample itself. Okay, HEV RNA quantification. So that can also tell you the level of infection. Treatment, I told you there's no need of treatment when you are affected with, when it is affected with acute hepatitis E. This is self-limiting, hospitalization not required. Okay, but when they turn fulminant, okay, fulminant means severe liver function. Okay, the liver totally stops functioning. Okay, so when they lead to a condition like fulminant, then only hospitalization is needed. Okay, hepatitis F and G, F reported in 1994 and G in the year 1996. F transmitted through contaminated food or water, and then G responsible for a large number of sexually transmitted and bloodborne case of hepatitis. It causes both acute and chronic hepatitis, and it affects person already infected with HCV. So it is always causing a co-infection with hepatitis C virus. Okay, what's the pathophysiology of hepatitis? What happens during acute hepatitis? Liver damage is mediated by cytokines. You know what is cytokine? Cytokines are chemical messengers secreted by secreted by the immune cells and natural killer cells. Okay, so the liver damage is caused by cytokines and natural killer cells. So they cause lyse of the infected hepatocytes. The hepatocytes are getting damaged by means of the increased secretion of cytokines and NK cells. It leads to cholestasis. That means bile juice from the liver. Okay, there's an obstruction or there's a failure, okay, in the draining of bile to the intestine. Because a very important function of liver is to secrete bile, to store the bile in the gallbladder, and to get secreted in the intestine. So all these things are getting affected. Liver cells, I already told you, it can regenerate after acute infection. But yeah, when it is an acute infection, we not worry much. But when it becomes a chronic, okay, then only we have to worry a lot, because there is a lot of liver cell damage. A chronic viral infection can cause chronic inflammation. And not only that, that can cause fibrosis over decades. So normally we say, or normally the liver is made up of parenchymatous cells. Okay, so when there is a damage to the liver cells, okay, the parenchyma of the liver cells become fibrotic in nature. Okay, so at one point of time you can see only the fibrocytes and the parenchyma will be missing. Okay, so the liver function will also get deteriorated or totally absent. Fibrosis in due course of time can lead to cirrhosis of the liver. Cirrhosis not only occurs in hepatitis, but also, yeah, with severe alcoholic person. Complication. What could be the complication of hepatitis? Dehydration, hypokalemia, what is it? Potassium decrease. Chronic carrier hepatitis becomes a chronic carrier. What's a carrier? It can spread the disease to any number of people. Cholestatic hepatitis, there's an obstruction in the biliary duct. Fulminant hepatitis, serious form of hepatitis. Liver cirrhosis. And then hepatocellular carcinoma, cancer of the liver. Yeah. So this is a picture showing the normal liver with that of the cirrhotic liver. The red color, the dark red color of the liver is missing. Is missing with the cirrhotic liver. And you can see a lot of nodules because of infiltration of the immune cell, something like that. And then general measures. General measures. So how can you prevent hepatitis on the whole? Okay, hand washing. We have been doing for the past 2 years. Okay, due to coronavirus infection. Yeah, for any virus infection, you do a hand washing. When you do a hand washing, especially envelope virus, that will be killed. Proper personal hygiene during food handling, water handling, when you're handling children, when you're handling patients, when you're handling, any patient for taking blood, something like that. So follow proper personal hygiene. When you touch a patient, okay, take the utmost care. Environmental sanitation, yeah, when there's a spread of hepatitis A and E, so we have to sanitize the environment, because it is, I told you already, it is a disease born through food and water. And not only that, also screen the food handlers. So we have studied in many diseases, food handlers are or the reasons for the spread of infection. Okay, suppose they serve food in a hotel or in a conference or in a meeting, what happens? So at one point of time, many people will be affected. When the food handler happen to be a chronic carrier or an acute carrier, the infection depends on the level of the infection in the food handlers. The spread is that much to be concerned. Okay, so food handlers should be screened often for the hepatitis viruses. Okay, and then not only that, when a person travels from a developed country to a developing country or to an underdeveloped country, you should undergo a vaccination. Okay, vaccines are available for hepatitis A and hepatitis B, not for hepatitis C. Okay, so you can always take a hepatitis A vaccine, hepatitis B vaccine when they travel to a endemic area. And then avoid sharing toothbrushes, razors, etc. Wherever you have the risk of blood transmission. Okay, blood transmission. Don't think always transmission only lead to, infection of uh, virus. Okay, even small cuts. Okay, so even a dentist can pose a threat to you. Okay, toothbrushes, razors. Okay, handling. Okay, when you open, when any blood vessel is open, okay, that person is a threat for others. When is contaminated needles or instruments happen to touch a non-infected person, and not only that, HBIG, that is hepatitis B virus, immunoglobulin. It's a pooled gamma globulin. Passive immunization. Studied in your earlier classes, hepatitis B, immunoglobulin administration for one-time exposure. Okay, that is needle stick injuries. Yeah, needle stick injuries is very, very common with the health workers. With microbiologists also. Sometimes we open a needle to draw blood from a patient, say from a HIV patient or hepatitis B patient. Okay, so when you have taken the blood, but when before you discharge the blood into a, what to say, test tube, when you prick others, that is called as a needle stick injuries. Needle stick injury has been the reason for the spread of many, many viral infection. Avoid needle stick injuries. So when you're handling blood, be very, very cautious. And contact of mucous membrane, I told you, yeah, dentist or a, what to say, ENT surgeon, they all should be uh, they all should be aware of this HIV, hepatitis B, hepatitis B or C or D, any hepatitis infections. For healthcare personnel, okay, so healthcare workers, so they have to use infection control precautions. Yeah, whatever procedure is, what to say, advised at the particular time. So washing hands, regularly washing of hands, using hand sanitizers, antiseptics, etc., or use a glove. Okay, use gloves. So normally we advise, okay, all our students to wear gloves before they take the blood. Okay, so removal of gloves. So you have to wear the glove. Okay, gloves. You have to wear the glove, or frequent hand washing, frequent hand sanitizing should be undertaken. Okay, and reduce contact with the blood or blood containing secretions. Okay, even saliva. Saliva can also pose a threat to hepatitis B or C or D. D. Okay, so we say always a bucket of saliva. A bucket of saliva is equal to one drop of blood. Okay, a bucket of saliva can cause infection. It's equal to a drop of blood. So saliva can also pose a threat to the infection. And then use infection control precautions and use of immunoglobulin, that is pooled gamma globulin. Okay, so you take the serum from the patient who has been treated with, or what to say, who has been vaccinated with hepatitis B. Okay, so that is called as a pooled gamma globulin, and it can be given. That can be given to the patients. So why do you give a pooled gamma globulin to the patients? So we can reduce the risk of HCC, hepatocellular carcinoma. Okay, that is why we give HBIG